The Ondo state government says it has recorded tremendous achievement in the fight against Lassa fever. The State Commissioner for Health, Wahab Adegbenro, told reporters in Akure that the state has not recorded any new case of the disease in the last 2 months. TVC's Ayodeji Muradeyo has details.
Ondo State, southwest Nigeria, used to have the second largest burden of Lassa fever in the country. The state came behind Edo State with 91 confirmed cases and 23 deaths after the outbreak of the disease. But week after week, the situation was put under control. The State Commissioner for Health, Wahab Adegbenro, who confirmed the present status, commended the management of FMC Owo for the efforts aimed at curtailing spread of the disease.
With the help of Almighty God, we have been able to put Lassa fever under control. As at now, we have 0 admission. That is, there's no case on bed. So, but we will continue our efforts with sensitization and so on, so that a repeat performance will not occur again.
As part of measures to combat spread of Lassa fever in the country, government will establish a clinical laboratory in Owo.
That within the next year, we will make sure that we have a laboratory here in Owo so that we can diagnose these cases here and not have to send them across the country. So given the prevalence of Lassa fever in this environment, Ondo State and Owo specifically deserves to have a diagnostic center.
The Chief Medical Director of FMC Owo, Ahmed Liasu, said the establishment of the laboratory will go a long way in assisting the hospital to tame the disease in the state.
For us to diagnose the disease, of course, it has to be diagnosed from the laboratory. And what we are doing now is to send our specimen every morning to Irua. So one will be very happy to have the laboratory right here in FMC Owo.
As key players continue to collaborate in the fight against spread of Lassa fever, it is believed that the disease will soon be put under control. Ayodeji Muradeyo, TVC News, Akure, Ondo State.